Good morning, everyone. On behalf of the National Academies, I'd like to thank you all for attending our virtual workshop, Improving the Evidence Base for Treatment Decision-Making for Older Adults with Cancer. I am Monica Bertagnoli and chair of the Workshop Planning Committee. As a quick reminder, the intent of this workshop is to examine the root causes that limit enrollment of older adults in cancer clinical trials, and to develop strategies for improved inclusion of older adults in cancer research across the entire drug development continuum. This workshop is sponsored by the U.S. Food and Drug Administration and convened by the 3 forums of the National Academies, including the National Cancer Policy Forum, the Forum on Aging, Disability, and Independence, and the Forum on Drug Discovery, Development, and Translation. This is the third and final day of our workshop when we have 3 sessions planned today. First, we will hear about opportunities to build the evidence base for treating older adults with cancer in the post-marketing context. Following this session, we will convene the moderators of the previous sessions to summarize key points from throughout the workshop and to hear their recommendations for advancing further progress to improve inclusion of older adults throughout the drug development continuum. And then finally, in a very brief session to conclude, Dr. Harpreet Singh from the FDA and I will synthesize what we have heard and discuss an action plan to move forward. So to those listening today on the public webcast, we encourage your active participation in the workshop. Please use the chat box on our website to ask questions and contribute to the discussion. Your input is conveyed to the participants in the discussion. And now I would like to turn over to our session 4 moderators, Dr. Randall Oyer and Dr. Richard Shilsky.
Thank you, Monica. Good morning, everyone. I'm Randall Oyer. I'm the director of University of Pennsylvania's Barshinger Cancer Institute and current president of the Association of Community Cancer Centers. I'm joined by my co-moderator, Dr. Richard Shilsky, who is executive vice president and chief medical officer for ASCO. We're thrilled to moderate this session, which focuses on post-marketing strategies and approaches to improve the evidence base for older adults with cancer. In this session, we'll be hearing presentations from 5 speakers, providing different perspectives on post-marketing data collection. As a quick note, full bios are included with the briefing book posted on the website. And with us today, we have Dr. Bindu Kannapuru, who is clinical team lead for multiple myeloma in the Division of Hematologic Malignancies 2 at FDA's Office for Oncologic Diseases. We have Dr. Dawn Hirschman, who is Director of Breast Oncology and co-leader of the Cancer Population Science Program at the Herbert Irving Comprehensive Cancer Center at Columbia University. Dr. Robert Miller, Medical Director of CancerLink, a health education technology platform for oncology developed by ASCO. Dr. Deborah Schrag, Chief of the Division of Population Sciences at Dana-Farber Cancer Institute and Professor of Medicine at Harvard Medical School, and Dr. Jennifer Malin, Senior Medical Director for Oncology and Genetics at United Healthcare. As a quick reminder about the session format, the sessions have been pre-recorded and will follow sequentially. We will then begin a panel discussion, which will be moderated by Dr. Shilsky, who will introduce 2 additional panelists and moderate the discussion. Reminder, we encourage your active involvement. Please use the chat box on the website to place your questions, and we will answer as many as possible. Thank you for your attention, and we are ready to begin the presentations. Thank you.